Good afternoon, and thank you for joining us for the Thursday edition of the COVID-19 virtual media briefing for London and Middlesex County with London Mayor Ed Holder and the medical officer and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. As always, we welcome the media in attendance and remind them to submit their questions indicating their media outlet as well as their name. And to those tuning in on Rogers TV, on the Rogers Facebook page and Rogers YouTube channel, we welcome you, as well as listeners to Global News Radio AM 980 CFPL, and those tuning in this afternoon on the CTV London website. We'll start with opening statements. Mayor Holder, we'll go to you.
Thanks, Dan, and good afternoon, everyone. I have some good news this afternoon where City of London Parks amenities are concerned. As you know, we've previously reopened 2 of our 3 golf courses, along with all of our off-leash dog parks. So we expect to have updates very shortly, later today, in fact, on the status of outdoor sports fields and baseball diamonds, skate parks, basketball courts, tennis and pickleball courts, disc golf, and benches, picnic tables, and park shelters. We have said time and again how important it is to self-distance. That doesn't change. But we also know that Londoners are excited to get some fresh air and exercise, as we appreciate their patience while city staff work to get these parks amenities open. Parks are a vital part of our life in the Forest City, and we're counting on everyone to do their part to keep following the health precautions that will ensure that these are safe places for everyone to enjoy. Second point, there's a growing movement during this pandemic to shop locally. We've all heard about the need to do that and to support London-based businesses. I think it's a great initiative, and it's one I hope Londoners support, especially now that more businesses are starting to reopen. I've heard from a number of businesses, particularly those in the restaurant and food takeout sector, who are seriously struggling during the pandemic. Restaurants are truly hoping that customers will pick up or use their own delivery system when available, instead of some of the traditional, or I would say newer facilities like Uber Eats and Skip the Dishes or other app-based methods, which are all legitimate businesses. But here's the thing, supporting the restaurant directly, again, by picking up yourself or through the restaurant's own delivery service, not only dramatically reduces your expense, it also provides local restaurants with a greater retention of the amount that you're spending. Because when you use other apps to order and receive food, in some cases, restaurants are barely breaking even, while others actually lose money on their orders. Some of these apps take a commission of up to 30%. So I understand for those who are immunocompromised or don't have pickup access themselves, that picking up and the inability to pick up food directly from a local restaurant, that might not be possible. For those who can, and when it's an option, it's something I encourage. The restaurant business, in my view, has been impacted to a greater degree almost than any other sector during this pandemic. They need our support, and this is an easy, straightforward way we can help. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So starting with the numbers, we have not seen any decline in the latest provincial or local bump in cases. We're now at about 12 days provincially where we have seen an increasing trend in cases. It's not increasing rapidly as it did when the pandemic first hit, but it's a gradual increase over the last 12 days provincially. Locally, again, smaller numbers, the number is bouncing around a bit, so it's uncertain, a bit more uncertain exactly how the rate is changing locally, but it certainly isn't decreasing as it had been for the 2 or 3 weeks prior to this last week or so. Provincially, we saw 413 cases announced yesterday. Locally, there were 6. The provincial cases continue that upward trend. And again, we'd seen numbers below 400 for almost all of May. And now we're seeing numbers above 400 again. So something we're watching very closely. I think over the next day or so, we will be making the determination whether we can confidently say that our local numbers are continuing to rise as the provincial numbers are. We have seen the province slow down the openings, which I think is absolutely appropriate And I would imagine that that continues going forward as well. Dan, I know there were some questions about a discussion that happened online around the hospitals, so I'll jump just into that now. So I had commented that it was an honor to be part of supporting the hospitals in their efforts to move towards reopening. It's no secret that across the province, the healthcare system has been looking at how do they begin to resume scheduled surgeries, hospital clinics, that sort of thing, which have been put on hold for months now. Local public health has been asked to work with the hospitals to make sure that everything is ready to go in terms of those hospitals reopening services gradually. Public health has not been asked, I want to be clear, to comment on the hospitals of which services should open when or how they should be opening those services. Hospitals really are their own experts on how to operate their facilities. But for example, the provincial process that Ontario Health has put in place asks medical officers of health to comment on the rates of disease in the hospitals, the rates of disease in the community, attesting that they are manageable in the hospital and in the community, which is the case for the 3 hospital systems that we support here: London Health Sciences Centre, St. Joseph's, and the Middlesex Hospital Alliance. There's also an attestation around the plan for preoperative testing. Many surgeons and surgery services are moving towards testing each patient for coronavirus prior to initiating surgery. That can be useful both in terms of making sure that appropriate precautions are put into place if someone's diagnosed positive, or ensuring that surgeries are triaged appropriately. Some surgeries are very risky to do in an individual that has an infectious disease, aside from the potential of exposing others inside the operating room. There's also a question in the provincial attestation process that asks the public health unit to comment, confirm the hospital's assessment of the long-term care and retirement homes in that hospital's local geography. And of course, we've been able to do that as well. So that's the involvement that we have had. Again, very impressed, as always, with the leadership at London Health Sciences Centre, St. Joseph's Healthcare London, and the Middlesex Hospital Alliance. These are world-class facilities that know how to do things right inside the hospital. That's it for me for now, Dan. Happy to take any further questions.
All right. Thank you, Dr. Mackie, and thank you, Mr. Mayor. Looking at the questions, Dr. Mackie, I think there's one that has to do with your discussion just a moment ago that I'm thinking Steve Young at CTV London would like a little bit of clarification on. Dr. Mackie, what was your role in helping to open up the hospitals in our region?
Yeah, so just to be very clear, we're not talking about opening hospitals tomorrow. We're talking about the planning process to make sure the hospitals are ready when they get the go-ahead from the province, and when it's very clear that each of the pieces of the puzzle are in place. And the role of the local medical officer of health is on those specific questions. What's the rate of illness related to coronavirus in the hospital? None of our local hospitals in the Middlesex or London area have outbreaks of coronavirus right now. They're certainly treating patients with coronavirus, but not patients who have acquired coronavirus in the hospital. So that one's easy to answer. And then, is the rate of illness in the community stable or decreasing and at a manageable level? And certainly we're seeing that as well. The rates here in Middlesex and London have been substantially lower than in other neighboring communities, and our community is handling those well from a healthcare, social services, and a general society sort of perspective. And then there is that specific question around the hospitals being able to support the long-term care facilities in the area. And again, we've worked with each of our hospital partners and are confident that they are able to provide support as needed. This has actually been one of the most exciting parts of the pandemic. Probably the biggest highlight from my perspective is that the healthcare system has really begun acting like a system more so than ever before, where you have hospitals and long-term care working together to make sure patients are safe, make sure personal protective equipment, masks, etc., are moving to the places that need them most, making sure even staffing across different facilities, hospitals sending staff to support long-term care or other facilities. These are pretty major innovations in the system, things that have never really happened before in the Ontario healthcare system. And they're facilitated by two things. One is Ontario Health, which has a very strong mandate to integrate across the healthcare system. And the other thing is the directive from the top of the government around making sure that partners are working together to address coronavirus and the effect it's having on populations that the healthcare system serves. So on the one hand, the administrative mandate to do that integration, and on the other hand, the political imperative pressuring to make sure that that integration happens effectively, that has really made things come together in a way, that in some cases in days where it would have taken years before to bring everybody to the table, get everybody on the same page, and get everyone moving in the same direction together. So that's been a real positive, and it's one that I hope and anticipate will continue on beyond the end of this pandemic wave.
Gentlemen, there's been a lot of discussion and stories in the media over the last few days after comments and recommendations from both the federal government and the provincial government about wearing masks when physical distancing is a challenge or impossible. So with that in mind, Dan Brown has the next question. Dan Brown from the London Free Press. For both Mayor Holder and Dr. Mackie, are you wearing masks when you're out in public?
Why don't I start with that, Chris, if I can? I've certainly taken the advice and direction of the medical officer of health with respect to this, and I'm very mindful that there may well be a place for masks and should be a place for masks when self-distancing is not possible. I have actually made a point, while I have masks with me, I've made a point of ensuring that from my standpoint that I've self-distanced. But if I've ever felt that I have been too close, then I have used those masks for that purpose. So I see that Dr. Mackie is about to show off his mask. I will show off mine in a moment. So I will ask you to flip back to me so I can look equally handsome in it, but I'll turn that over to Dr. Mackie. But absolutely what we have said is that if you cannot, and we're quite serious, if you cannot safely self-distance, please wear a mask. Over to Dr. Mackie.
Thank you, Mr. Mayor. Very much aligned on this issue. There are two reasons why I leave the home these days. The first is to walk my dog around my neighborhood, and the second is to buy groceries. When I'm walking my dog around the neighborhood, we've got boulevards, lots of space on the roads. I don't wear a mask. And I haven't been grocery shopping for about a week. I can tell you the next time I do go grocery shopping, I will be wearing a mask. And, we've talked lots of times here about the importance of realizing that masks are not, a bulletproof vest that stops everything. Masks are primarily to protect the people around you. There is some potential to protect the wearer, but if that person is also touching their face, itching, adjusting the mask, or if they take the mask off in a way that's not careful, if they take the mask off carelessly and touch the part of the mask that may have become contaminated while they were wearing it, they may actually be putting themselves at equal or greater risk. And in particular, there's the risk that wearing a mask might make people feel, invincible. And I'm sure we've all had the experience of being in a grocery store or other close quarters where somebody wearing a mask is walking much closer to us than we feel safe. So that's a real risk as well. Wearing a mask does not eliminate risk. You still have to keep your distance as much as you possibly can. You've got to put it on and take it off very carefully. Lots of videos online of how to do that.
All right. Now, I guess we'll go back to the mayor. I see, Mr. Mayor, you've come back with your your mask on?
Look, never to be facetious, but I think it is important that when necessary, we have masks available just as we've indicated. I would also share with you it's somewhat harder to talk and do a media interview for this purpose, but it is a serious issue and we want people to take it seriously. Thank you.
All right. Thank you very much for that response. We're going back to Dan Brown at the London Free Press. Dr. Mackie, Dan has a question. If we were going to see a bump in cases after the long weekend, would we have seen it by now?
Yeah, so the cases on average take about 5 to 7 days to develop symptoms. So if there's an exposure, you're usually waiting 5 to 7 days to develop symptoms. And then after that, people don't usually go to seek care the moment they have symptoms. So there's a 1 or 2 day delay before they get tested. And then in our region, there's about an additional 1 or 2 days between the test, the swab happening in the clinical setting, and the test result being processed in the lab, result being available. So if the long weekend were a risk, that bump would likely not have shown up yet in the numbers.
Okay, so there's the answer to that question. Dan, Sawyer Bogdan has the next question. Sawyer Bogdan from Global News Radio, AM 980 CFPL. Dr. Mackie, this one is also for you. Does the testing criteria need to change if the province only did 10,500 tests on Wednesday?
So the question about the number of tests, let me start with saying from a public health perspective, 10,000 tests is more than enough to know what's going on in the community. If you're doing 10,000 tests across the province of Ontario, you can be pretty confident that you've got a stable basis on which to judge whether the number of cases is increasing or decreasing. I want to be really clear, that's for public health measures and public health interventions. When we're talking about clinical picture, there may be lots of reasons why a physician or a patient might want to know their test result. And so certainly if people are wanting to get tested, that's a different question than the public health question of how many tests are needed across the province. The other aspect of this is that the main reason why testing numbers are down has nothing to do with the criteria. Criteria have now been blown pretty wide open. Virtually any significant symptom will get you tested for coronavirus, certainly here at our local assessment centers and increasingly across the province. But what has declined significantly is people's interest in getting tested. You're seeing in our assessment centers here, for example, whereas a couple of weeks ago we had 200 tests a day, we're now seeing more like 120 tests a day. And that's simply because less people are coming in to get tested. Part of that is the attention being no longer so focused in the public's mind on coronavirus. Part of it is people being out in the good weather and not necessarily wanting to be sitting in waiting rooms waiting for tests, particularly when there's no specific treatment for this illness. So getting a positive or negative test result doesn't necessarily change their medical treatment. So really the test numbers have declined because the demand in the community has declined. It's fantastic that we have capacity to test so many more people. And it's also really positive that we don't need that capacity to be used right now, that we have excess capacity, and that across the province there's much less of a need for tests than there were 2 or 3 weeks ago.
Okay. Sawyer Bogdan has a follow-up question, Dr. Mackie, for you, and it also is about testing. And I think this might refer to some of the reports we heard earlier this week about tests expiring between when they were taken and when they were completed. So Sawyer's question is this: how long does it take between administering a COVID test to getting the results? Is that number different locally and provincially?
Yeah, so across the province, you do have a slightly different testing environment in each jurisdiction. In southwestern Ontario, most tests, particularly for people who are symptomatic, so people that are actually sick rather than just screening tests in people that don't have symptoms, Those tests get prioritized and they get taken to the London Health Sciences Centre lab. And the turnaround within the lab, once the sample gets there, is 24 to 48 hours right now. And that's a real positive from our perspective in terms of being able to know quickly whether somebody is positive or not. And that system has really been designed in partnership between the hospitals, the Ontario Public Health labs, and the local health units, so that people who have symptoms or people that are associated with a case, for example, an outbreak in long-term care homes, those tests get prioritized and they get tested quickly, and those turnaround times are great. It's 24 to 48 hours after hitting the lab. There sometimes is a delay, between the swab being taken and the swab getting to the lab. That delay is in the matter of hours, not days. And so we've been really well served by the Palm Lab at London Health Science Centre, which is actually run jointly by St. Joseph's and London Health Science Centre, and serves hospitals across the region. They've been able to prioritize those high needs, really important swabs that are going to inform clinical decisions and public health decisions. And the other swabs have gone out through the provincial Public Health Ontario lab system, which often then get sent to the private labs when the public system is at capacity. And then that's where you start to see more delays, because you're going through multiple lab systems before the swab gets processed. And also some of the smaller private labs are batching tests because of the efficiency, which might mean that a sample comes to them on day one and doesn't get processed until there's a critical mass of swabs on day 2 or 3. And that's where you start to see the longer turnaround times. So we've been very, very lucky in this community to be very well served by the Palm Lab at LHSC.
All right. One more question in line right now, gentlemen. This one is, again, for Dr. Mackie. It's from Dan Brown. Just wondering what you think of the Premier today saying he has a plan for random testing. What information will random testing give us that we don't already have?
So random testing is a crucial part of the picture, because there are so many things that can influence whether somebody comes to a clinic to get tested. The amount of coverage there is in the media can change the number of people that show up at a clinic to get tested. The weather makes a difference, all sorts of things. If we do random testing, what we're doing is eliminating those biases, those influential factors that are not related to, the spread per se, that might be related to the media or winds of change or even politics sometimes. So if we pull those out and we get a random sampling, it gives us a much stronger idea of what is happening in the general population, not just the part of the population that's motivated to seek testing on that particular day. There are really two things you need for a really strong surveillance system. And actually, the number of tests is relatively minor in terms of the overall surveillance system to know what is happening in a pandemic wave. The first thing you need is random testing, or what we would call sentinel surveillance. So sentinel surveillance is where you have specific primary care settings, family doctors' offices, for example, where everybody with influenza-like illness gets tested 24/7, 365. No matter who comes through the door, they would always get swabbed. Once that protocol is in place, and you do that in stable practices where there isn't a lot of turnover in the clients or staff, so you're not seeing a lot of variation for other reasons, you do that sentinel surveillance, and that gives a good picture of what's happening, and you do that all year, right? So it's not just what most clinicians would do, which is test for influenza in influenza season, for example, but you're testing all year and you can see those waves come and go. So sentinel surveillance. The other part is syndromic surveillance, and that's actually in place already. Syndromic surveillance is surveillance through emergency rooms at the level of triage data. So the triage nurse takes your temperature, asks you a few questions, and that data gets automatically entered into a provincial system that all public health units have access to across the province. This isn't diagnostic data. This is not like after the physicians come and made a formal diagnosis. It's syndrome data. So a syndrome would be influenza-like illness or diarrheal disease or overdose. And all of those syndromes are tracked through ACEs, which is the Acute Care Enhanced Surveillance System. And ACEs has been in place for years. And ACEs actually picked up the coronavirus pandemic wave that's come through over the last couple of months. The value of the syndromic surveillance is it'll pick up diseases where we know what the diseases are. So because it picks it up at the level of syndrome. So for example, if a pandemic actually originated in Ontario and we didn't know that it was coming and we didn't know what was causing it and we didn't know, what the actual disease organism was, syndromic surveillance would still pick that up because it would see people getting, say, influenza-like illness and going into the hospital even before we knew what was causing that. So we've got syndromic surveillance. It looks like we're moving towards a sentinel surveillance system, and once that's in place, that'll have real value, particularly going forward as we gather, months and years worth of data to compare with. It'll really help us understand what's happening across the province.
It's not just answering the media questions and sharing the local updates. I get the feeling that people are getting an extra dose of learning about what public health is and what public health does and the decision-making process when it comes to these bigger community issues at the city level as well. Gentlemen, that's it for the questions today. And thank you once again, Mayor Holder, Dr. Mackie, for your time, your insights, your expertise, and certainly for the updates that you provide. That gives us, that's a full wrap for today. We will see you again tomorrow for Friday's virtual media briefing. Have a great rest of your day.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
I'm Jeff, and anybody who knows me knows I love chilling in my backyard. The only thing I like better than chilling in my backyard is grilling in my backyard. So I decided to visit Londoners and see what they're doing in their backyard.